discuss about different types of breast tumors, breast cancers. So let's talk about it. So generally, what are they? Let's talk about the pathology, causes, treatment. So, diverse breast tissue disorders, often biologically female individuals, often benign. Younger people have the benign cancer, but the old people they have the increased chances of having cancerous metastatic breast cancer. Okay, talking about the causes is due to hormone stimulation or genetic predisposition. Complications, possibility that benign mass will turn into breast mass. Signs and symptoms, possibly asymptomatic breast size and appearance is changed. Talking about the diagnosis, how you reach to diagnosis in breast cancer, suggestive physical finding of medical history or any family history. For diagnostic technique, you use mammogram, MRI, and ultrasound. Lab diagnosis, you go for a biopsy and histological analysis. Talking about the treatment, so benign disorders may regress spontaneously, but the for cancerous mastectomy or lumpectomy is required. Either it is radical mastectomy or maybe just removal of the tumor and conserving the breast mass. It depends. Other interventions, alternatives, example, cryoablation or radiation therapy can be given. Let's talk about breast cancer in detail. So, pathology is diverse malignant breast lesions with different microscopic features, biologic behavior. Common increased common non-skin malignancy in biological female individuals, rare in biologically male individuals. Talking about the types is molecular subtypes are classified into estrogen receptors, progesterone receptors, human epidermal growth factor, that is HER2 expression, protein Ki6C1 levels controls cancer cell growth. So, if in luminal A, estrogen receptor and progesterone receptor positive, HER2 negative, decrease in protein Ki67 receptor. Luminal B is PR positive, HER also positive or maybe negative, increase in Ki67 levels. Talking about triple negative, in this all are negative, and this is this having risk of for triple negative is more in African females. Okay, HER2 enriched, negative, PR negative, HER2 positive. This is HER2 enriched. Normal like PR positive, HER2 negative with a decrease in protein Ki67. Let's talk about most common types of the breast cancers. So you have these are the benign one, but they can convert into malignant one. The chances is very high for DCIS. Invasive ductal carcinoma is the invasive one which metastasizes. Invasive lobular carcinoma and inflammatory breast cancer. Talking about ductal carcinoma in situ, in ducts, the possible invasive ductal carcinoma usually in same breast can occur, but in lobular carcinoma, the cancer will increase to the either breast. Okay, it's not like if it is there in the one breast only; it can spread to other breast also. Invasive ductal carcinoma, 70% of all invasive cancers. Subtypes of invasive ductal carcinoma is tubular, medullary, mucinous, papillary, cribriform. Like if it is DCIS, so you have comedo and non-comedo. In comedo, you find caseous necrosis in which dystrophic calcification can be seen. Non-comedo or papillary form, papillary finger-like projections, and you can also find cribriform. In some spaces are left in between. It is like a sieve, cribriform, and other is the solid form. Solid means all it is filled. Okay, that is for DCIS. For invasive ductal, you have tubular, medullary, mucinous, papillary, and cribriform. Talking about invasive lobular carcinoma, it occurs in either of the breast. Inflammatory breast cancer, rare, aggressive form, and poor prognosis. Let's talk about the causes. So this is the gross pathological appearance of breast cancer in a wide local excision specimen. So let's see about the causes. So genetic aberrations can be seen. Genetic aberrations, okay, mutations, hormonal exposure, inherited susceptibility genes because of familial like BRCA1 gene, BRCA2 gene. Okay, so 80 to 90% of single gene familial breast cancer, 3% of all cancers. Talking about the risk factors, breast cancer, prior history, age. As the age increases, risk increases. Breast cancer in first degree relatives, like mother, sister, daughter, like that. Individuals who are biologically females, the risk is high when compared to others. Turner syndrome. Okay, race, ethnicity, high incidence of in white people. Okay, talking about the hormonal influence, estrogen exposure, like example, menopause is there, but hormonal therapy is given. Early menarche is there, or late menopause is there. So the duration of estrogen exposure increases. Nulliparity, having no children, more than 35 years old at the first birth, then also the chances of breast cancer increases. Decrease, no, the duration of breastfeeding is decreased. It can also cause obesity, because obesity is related with aromatase enzyme. This aromatase enzyme, it causes this aromatase enzyme, it causes the so this aromatase enzyme, it causes conversion of the fat cells into the estrogen. Okay, toxin exposure, enhancing radiation exposure to radiation, or smoking, or chronic alcoholic in that persons, it can increase, or smokers also. Okay, talking about complications. So complications, so if you talk about the complications, metastasis, it can metastasize to bone, lung, liver, brain. Complications include lymph node resection, lymph node resection lymph node resection, lymphedema, cytotoxic chemotherapy causing infertility, chemotherapy, radiation therapy, cardiac disorders, cardiomyopathy, or myeloid neoplasms. Talking about signs and symptoms, possible asymptomatic, especially pre-malignant breast masses, palpable mass, hard, non-tender, irregular borders, immobile, palpable lymph nodes, axillary, supraclavicular, supraclavicular lymph nodes, these are palpable. So you have to look for the axillary lymph nodes and supraclavicular lymph nodes. Skin dimpling, that is orange peel skin is there. Nipple retraction is there. Okay, discharge is usually bloody in the cancerous one. Eczema, like a rash in Paget's disease of nipple. Okay, inflammatory breast cancer presentation mimics inflammation, tenderness, warmth, swelling, edema, orange peel skin over mass. So here you can see this is the tumor present. Diagnosis, diagnostic imaging, breast MRI can go for high risk individuals with mammography. Okay, and mammogram will define speculated mass clustered microcalcification. Document lab results, core biopsy have to look for histological analysis, tumor grading, immunohistochemistry, detect estrogen, progesterone receptor expression, HER overexpression, sentinel lymph node biopsy. Other diagnostics suggest a physical finding, or medical or family history. Treatment, surgery, lumpectomy, mastectomy, individual's choice. Other interventions, radiation therapy, chemotherapy, adjuvant hormone therapy, chemo prevention, and some cancers. So look here, treatment. If you look in the treatment, surgery, lumpectomy, and mastectomy, radiation therapy,